The company responded, Ann Wojcicki, she had this to say in terms of the FDA, what the FDA is sort of criticizing them for and looking for in terms of additional information. Here's what she had to say.
What's always been the challenge with the FDA is it's the first time that we've really introduced a broad genome-wide test. We said originally, we're kind of a square peg in a round hole. Do we fit in this existing system? And we agreed that we were going to submit some 510Ks, which is sort of the medical device process, and we submitted those, and we are in the process of doing additional tests that they want us to do, and we will resubmit.
She says there, essentially she sort of frames it as this is a matter of paperwork and submitting additional information that the FDA works. What's your assessment of her assessment of sort of the next steps? I mean, she sort of frames it as being inevitable, that this will happen.
Well, so she's been saying for several years, or the company's been saying for several years, we're working on it, we have tests in the process, and they've never produced any. So the FDA said for several years, okay, I know you're working on it, you're going to get us something soon, and it hasn't happened. And after several years, the FDA finally said, look, it's been several years, you haven't produced it. It's one thing to keep saying, we're going to do it, we're in the process, which she again just said there. So I think that's the problem, is at a certain point you have, and I should say part of the reason some critics say she's been delaying is 23andMe's real goal is to get 1 million people to give their DNA. They already have several 100,000 people's DNA. And with that, if their goal, in fact, is really just to get lots of people's DNA, the reason they want that is because with that kind of information, they can make discoveries and patent things. And so if I have 1 million people's DNA, I can make discoveries, I can patent things that I find, and I can make lots of money through that. So the real goal here is not to offer perhaps beneficial medical information, but to get people's DNA in terms of the real goal financially is not the $99 per test, but the millions that could be made potentially if one discovers and patents certain things in the genome.